So while others are, the delegates are joining in, maybe you can start off with the introductions. On that note, first of all, I'd like to thank every one of you. Thank you, Nishant, Ashish, Neha, Devang, Anjali, for confirming to speak for this very interesting and relevant topic. And this is not just relevant to what for the investors per se or startups in terms of opportunity. This is something which is relevant for every person who's stepping out of their homes right now and possibly will be joining office in due course of time. So this is a very relevant topic for everyone, and I'm sure we'll have a lot of insights. We'll also have some interesting polls during the session, and we'll be happy to share the results in due course. And so over to you, Nishant, if we can start from you and then go across the dais for the introductions, and then jump onto the main topics hence after.
Thanks, Amit, and good afternoon to everyone. I guess after 3 months of lockdown, people are coming to terms with what's really impacted all of us personally as well as professionally. People have had various experiences now with some parts of the economy and some parts of the country being unlocked. We've spent the last 3 months figuring out the impact on our business and how to deal with some of these situations. We have with us a power-packed panel today and an extremely diverse panel of 5 panelists, 2 of them from the healthcare sector. 2 of them are in the business of renting out space, and 1 of them is in the business of investing in all of them. So it would be extremely interesting to hear from them how their businesses have been impacted and what lies in the future for each of our businesses. And I think we will also focus the discussion on the topic being the workplace and the safety of the workplace and practices and trends that we're seeing today, both in the short term and what we expect in the long term. We have Ashish Chawla, who's the head franchise ops India and South Asia for Oyo Rooms. Welcome, Ashish. Nihar Chirabudi, he is the CEO of Dr. C, which is a company in the healthcare space. We have Amit Ramani. He is the founder of Office. We have Anjali Ajay Kumar. She's the Vice President Strategy of HCG. And we have Devang Mehta, who's a partner at Anthill Ventures. So welcome all of you. And I'm really hoping to make this an interesting discussion. We've got quite a few participants who've logged in already. And I'm sure all of them are looking forward to this discussion. So let me kick it off with the impact of COVID and how COVID has impacted each one of your businesses and how you are responding as a business to the situation. How is work from home working out for some of your organizations? And is work from home a long-term trend? How do organizations treat office space going forward? As a manager of a law firm, we have about 150,000 square feet of space across the country. And honestly, they've all been shut for the last 3 months and we've been paying rent. How do organizations look at space and their space requirements going forward? I guess in the context of Anjali, it becomes extremely important. A hospital is a workplace for the folks for doctors and nurses, right? And it is a place to visit for patients. Likewise, for Ashish, you will have customers staying in your spaces. How are you looking at this? How has this impacted your business? And more importantly, How do you see the long term as well as the short term trends? Let me start with Amit Ramani, the CEO of Office, and hear some of his thoughts.
Thanks, Sushant. Glad to be here. So clearly the business is impacted, right? The pandemic has impacted every single sphere. Clearly, we had a bit of a, almost a no shows in April and May, with the occupancies almost being zero. We've opened back our centers uh, since early May. Most jurisdictions are open, other than probably Mumbai, which has some limitations still. Occupancies range anywhere between 10% to about 40%, right? So clearly that fear has not gone away. People are a bit hesitant, and as a result, the business has, clearly been impacted. But I think what's important is to, kind of understand what's reshaping all of this, right? I think a couple of things have happened. One, from an organizational standpoint, they have clearly understood that productivity is not a factor of having your own office space, right? I mean, because majority of us have businesses which have continued to operate, right? All of us in various capacities have businesses that have continued to engage employees, ensure that productivity continues, and service our customers in whatever capacity we can. So clearly, one thing has become, the way we like to think about it is that basically geography has become history, right? Because earlier it used to be the mantra was location, location, location. I think now it's location, choice, and time, right? So I think clearly there are certain organizations which will come back and will try to imitate the past. I think the smarter ones understand that it is no longer about just having a conventional office location, because to bring people and make them travel and spend that kind of time is somewhat passe, right? So you have to adapt to the current reality, which basically the organization needs to save money, have a business continuity planning, and that requires you to move away from one eggs in one basket. So one headquarter location is a bit of a past as we see it. I think people will have multiple locations in a city, both for saving cost as well as business continuity planning. But the bigger trend that we see today is with the employee, because the employee is now said, it's about my choice. You better make it very special. If you're going to ask me to travel every day 2 hours and give up that time, which I was, oh, by the way, productive last 4 months, I am not going to do it. So I think work from home, remote working, which is work near home, and a special place called office will have to be curated as people come back. And I obviously we have a very strong view on work from home. I think the reality is we were about 2% of the country was work from home before pre-COVID. Our sense is 15% of the country will be continuing to work from home. We did a survey of about 5,000 people, and 90% of the people wanted to continue to work from home even post COVID. And that's telling of what's happening in India and the world right now. So I think it'll be a completely different world when we try to come back into the workspace as we know it.
Amit, some very interesting observations. And I agree with you, but you're a person whose business it is to rent out office space. How are you responding to the challenge?
So, Nishant, we kind of looked at it in a bit of a different angle, right? We said we are work enablers. At the end of the day, why was co-working doing well before the pre-COVID era? It was doing well because we gave people flexibility, no 6-year, 9-year lock-ins. You could come in for a day or you could come in for 5 years. You made the choice, right? Second was capital conversion into operating kind of a environment, and which is basically what people need today, right? The companies don't want to spend their capital; they are constrained for it. So operating expense is better in a plug and play kind of environment. And third is the network effect, right? Work near home, remote working, all of these solutions. So we just expanded our, framework, and we said we are work enablers. So we will provide you a office at home solution, AWFIS at home. So we have launched that as a product where we are selling subscription of an office smart desk and a chair at home, includes IT support, includes a broadband service, etc., replicating the office at home. Second, what we did was we said we have 70 locations across India, right? The highest number of locations, so 15-minute driving radius to any place in the 7 metros, right? So you could come in and easily be remote working or work near home, right? And the third, our centers continue, right? So anybody who wants to travel, want to be in CBD, has data security issues, has to have a broadband that's not available at home, that still continues. So we just diversified as a work enablement company rather than just being a co-working business.
Yeah, yeah. Look, adversity brings out the best in people, and I'm sure there's a lot more innovation coming up for a lot of our businesses to stay relevant and thrive. Ashish, let me come to you and ask how you have been responding to the challenge. Oyo is a very, very, very visible company, and perhaps one of the greatest startups that we've seen in this country. And in a way a leader, right, in your segment, and you guys will set the trend going forward as well, hopefully. So how are you responding, and what lies in the future? Give us a peek.
Right. So thanks, Nishant, and good afternoon to all the attendees here. So, as Amit also mentioned, no one is immune to what has happened, and neither were we. Travel sector, as we all know, has seen maximum impact, I would believe. And while the impact has been huge, good thing again is that we've been able to adapt very fast, and we were able to find opportunities even during lockdown was there. So two things were happening during lockdown in terms of Oyo. First was just trying to serve people. So we tied up with medical organizations, hospitals across India to provide safe accommodation to healthcare professionals, like who are on the front line, uh, to provide accommodation to people who were asymptomatic, right? Did not want to go home, could not go home because they did not want that. Even they might feel that they might have been infected, but they are not right now, or they don't know, and they don't want to go back to their family and infect everyone. So we provided accommodation to them as well, and then created quarantine centers as well out of hotel network that we had across 400 500 odd cities in India, tying up with embassies, tying up with India's Vande Bharat mission. So all these opportunities came in. We thought of these, and then what we did radically in behind was just quickly adapted the SOPs basis the requirement of the guest. Now we realized, because COVID has happened much earlier, it reached India in March, it entered the world somewhere in November, December, right? And we were present in China as well, so we had those learnings with us, behind us. So we learned from customers, we spoke with customers across different geographies. Am I not audible? Someone just, can you hear me?
I can hear you fine, Ashish.
Okay. Right. So we learned from that. We did our all customer surveys. We realized 2-3 things are super important once the COVID hits. First is how ready you are with your SOPs in terms of making things hygienic, more clean, increasing the frequency, using the right chemicals, going to the touch points, frequently cleaning those touch points, for example, right? How good are you with those SOPs? So we went back to the drawing board, looked at every single operation that happens, let's say in a hotel, starting from check-in to in-stay to in-room service, in-room dining, cleaning, etc. We revamped those basis what we learned from guests, that need of making things hygienic and clean, much more cleaner with the right chemicals, and second is making things contactless as possible. So right, so once this hit India, we were ready with those things in our hand. So we knew that once this happens, no one could predict the scale. Even today, we don't know what's going to happen in the next 2-3 months. So with that knowledge with us, we were able to quickly ramp up, modify the way our hotels operated, the way our spaces operated, the way our workspaces operated, so that we were able to not just give the assurance to people that it is safe, but actually ensure that it is safe. And another one thing that worked very well for us is having a very strong emergency response. Because again, see, we are interacting with so many people across India, and we have had those cases where some guests, for example, were found positive later on, but with the help of a massive good strong, highly reactive emergency response, we've been able to contain all those situations in a very, very easy manner, right? So that is what has worked for us during the COVID. And again, since we started coming out, just Unlock 1.0 happened early June. Again, with the same SOPs, we were able to release these SOPs for normal hotel operations also, where a regular guest can check in, feel very safe, because we have something called a sanitized stay program. Again, it's a name that we've given us. A lot of companies are doing the same as well. Again, using the basic principles of social distancing, increasing the cleaning frequency, getting the SOPs adapted to the changing consumer or new consumer needs as there are there, and ensuring that end-to-end experience, the guest is safe, not just feels safe. It's both. And then communicating it very, very transparently and proactively, right? So for example, even in the office environment, we inform guests much earlier that these 5 things are going to happen. You're going to go through this particular process. You're going to see that people are wearing masks. You're going to see sanitizers. You're going to see temperature of our staff being placed at a notice board. So all these things create that sense of safety, and that is working well for us. So right after Unlock has happened, we've seen the early green shoots of recovery of regular travelers, which was obviously completely not there during lockdown. So regular travelers, regular people who are visiting hotels and our workspaces. Coming back to the second point on the productivity side, again, see, work from Oyo. In Oyo, we have a massive franchise network, again, around 400 odd cities, and a lot of pre-COVID, a lot of work was relationship based, where we would go and meet our partners. We'll have those long meetings. We'll do our staff training in the property, where we'll show, display how things are done, how to treat guests, how to do chemical treatment, how to wash things, how to dress up. All these things used to happen at the location. Now, once the lockdown happened, obviously we could not do it, and we had to introduce newer SOPs, which were a bit more complicated than earlier ones. So in that case, I think the use of virtual platforms and us being able to internally deploy our own tech, our own productivity tools for our ground staff, for our partners, enabled us to communicate with them at a very, very close level. And with that close communication, and we simplified the content, we modified our SOPs and simplified all of that. So with that close communication with our partners, with our ground staff, while we were working from home, we realized that the productivity actually did not have any impact. We in fact found that, and like, we are one of those organizations where productivity of staff actually improved, because yes, they were not traveling, they were not wasting time in travel. Everyone was on calls, and they could connect with partners and people within the organization at with just click of a button. So that helped us improve productivity. Going forward, I think again it's going to be a mix where we continuously monitor. Work from home has been, specifically for Oyo, has been working well. Now, yes, there are certain teams who need to coordinate with each other, and with Unlock 1.0 happening, and we having our own spaces as well across India, in workspace areas which are again sanitized, and we've made them very safe with new SOPs. Whenever there is a need, people do feel very comfortable in going there, having a short meeting with the team, if that kind of sync up is required. So I think going forward in the medium term, there is going to be a good mix of work from home and work from office, again depending on how safe things are in the office areas. So yeah, that's it from my end.
Thanks Ashish. Let me come to Anjali. Anjali, I'm sure you've been extremely busy and perhaps stretched in this environment. And thank you actually for sparing the time and joining us. Anjali, how is it right now in the hospitals? I'm sure the last 3 months have been crazy. How have you responded? How have you made your hospitals safer workplaces and safer for your patients?
Yeah, I mean, it is thank you. It's a pleasure to be on this panel today. It's been kind of a roller coaster ride, I'd say, in the last few months. There's good, there's always a learning for each thing. So I'll talk a little bit about kind of what is happening on the hospital side. Initially, of course, as the lockdown happened, we saw a huge decline in patients. And our first concern was a lot of our hospitals are focused primarily on oncology. We have 5 multi-specialties and some 22 oncology hospitals. So that our first focus was on, in our oncology segment, how do we keep our patients safe, but also how do we ensure that our patients can have access to doctors and can have access, because mortality in cancer is higher than in COVID, and it's still emergency care. So we first had to work with, I think, government officials and everyone to explain that cancer is a needed care, and it's an urgent care. It doesn't go in the same level as dentistry and knee transplants and other things. So that, I think that communication and education took a lot of effort across all the states that were present, because we had to talk with each CM at each state, had to talk to the government levels, educate everybody on how cancer is so important for patients to have access for care. And the second thing was providing transport for them, providing letters, providing all the small details so they can get to the hospital. One of the big things that we did immediately as soon as the lockdown started was we had a plan for going to virtual consults within the next 4 months, but we expedited it and got it rolling within a week. So we could get all our patients on virtual consults, anybody who had reports and tests. So we did that. We also increased our home care at a lot of our centers for any bliss or any checkups were all happening at home. Normally, patients would come in, get their blood report, wait for half an hour, then start their treatment. But we kind of curtailed that and did that. So that was on the patient front and trying to keep them safe. On the employee front, I think the biggest challenge was, having doctors, nurses, everybody on the front line. How do we take care of them the best? And initially we had, PPE equipment, everything, we had got it in advance because we knew it was kind of coming, and we had gotten about 3 months worth of stock, everything, but it got used quickly because people were taking it for, their family members, taking it for other things, or disposing it off very quickly. So we had to put protocols and processes in place for that. But we also had to change the entire way we do nursing planning, for example. We started doing different shifts for nurses, and we had to separate out where they stay in hostels. We had to separate out floors. We said, okay, those people that are on shifts for 14 days will then not go on shift for 14 days. And the other big challenge was our nurses were stuck and they could not go home. So we had to put a rule in that they couldn't leave the hostel. So trying to find entertainment and other things for them. It's a big challenge when you have about 3,000 nurses across our network spread all across. So that was some of the challenges we faced to make sure that they're getting enough of the food requirements that they need. And, we had, of course, supply chain, some issues there. So we tried to do it. The other big challenge was, of course, getting medication across the borders. Normally in the HCG group, we get a lot of our medications in our flagship unit in Bangalore, and then we kind of send it out. We have a there. So then getting that out to a lot of the units, getting simple things like thermometers out, or getting PPE equipment out to places like Vizag or other places was a little bit of a challenge. So these were the initial challenges. All of those have been worked out now, I think, and now we're really focused on how to continue to safeguard our staff and safeguard our patients from every moment the patient is coming in. Before they even enter the hospital, we do all the checkups before they come in. So all our hospitals have tents kind of set up outside. Patients go through that before they're allowed in the hospital. Any patients going for surgery, other things, we do, kind of a triple check process for them, because there's a lot of people, in operation theaters and other things. So it's been a big learning, I'd say, on that. And then one of the biggest challenges now, as we kind of look forward a little bit on productivity, but also looking at the safety, is how do we reduce? So historically, if you go to a hospital in Europe or the US, you'll see very few people in the hospital. But in India, typically what we've done, and all the hospital groups have done, is you hire more because it's less expensive than investing in high-end technology. From CCT cameras that have maybe AI technologies, you say, okay, it's less expensive for me to hire security guards and put them everywhere. And people depend on people more. So they're like, oh, they'll listen to the security guard more, or we'll have more housekeeping people or more F&B people. Like, so that has been a big change where we're now looking at changing that strategy to see what are ways we can use technology and other things to reduce the number of non-clinical staff in the hospital to ensure that we're safeguarding our employees and our patients. So that's kind of our next step of going. And I think I mentioned it in our previous discussion, simple things like when I was a child growing up in the US, I remember there was a robot that served food for patients. And this was 30 years ago. A robot is serving food to patients, and that was common, but we don't have that today here. So those are some things that we might introduce and look at, what are ways that we can make it less human contact so the COVID doesn't spread everywhere. So those are the things within the hospital segment. Within our office segment, or in our corporate office and other things, we overnight changed our entire policy to work from home. Even now, when things opened up, we just require people to come in once or twice a week to come into the office, all separated out in different groups. So, we've changed the entire thing. We've closed down a couple of floors, where we're like, okay, let's, save some cost by not having to have so much office space. And I think our employees are also becoming, in a lot of ways, the feedback I'm getting from them is that they feel more productive, but they feel very, very less connected with people. Every call is very business oriented, and it's not so personality oriented, like, how are you, how's your weekend, or having a joke or talking about anything else. It's all like, that's just maybe the first 1 minute of the call, but everything else is very business oriented. So I think that's a challenge that now I see after 3 months that people are voicing that concern a little bit more. They're getting tired of being stuck in one room and talking to a black box. So I think that's the difference that we've seen in the office structure. So those are the things, but I think, generally in healthcare, it's something, and I forgot to mention the good part. The good part is that we've seen a huge decline in infections. So previously you would have seen people, doctors, nurses, I manage our quality for our group. So we do hand infection rates, we look at hand hygiene, and we do it through cameras. We have infection control nurses acting like spies in the hospital, saying, did that nurse or did that doctor wash their hands properly, or did they do this, in order to make sure that infections are less in the hospital. But now, because this pandemic has come, everybody has realized that to protect themselves, they have to be very careful in washing hands and not having so much contact. So we've seen a decline in sepsis infections happening in the hospital across. In fact, I think we're in the process of publishing a paper on the same. So the good thing is that our patients are actually becoming safer on other elements that might, hospital-borne infections. Everything has declined because everybody's safeguarding and being a lot more careful, which I think is a very positive thing. So some, silver lining in all of this that we're seeing in the hospitals.
You mentioned something very important with work from home and the lockdown. People have lost the human contact, right?
Mm-hmm.
I think that's what everybody's missing. It's, but I think that kind of segues into what Nihar is doing. Nihar had a certain business model pre-COVID and was very quickly able to pivot into providing a service which will hopefully make office spaces more safer going forward. Nihar, talk to us about what you've been offering to your clients.
Nihar, you're on mute. If you can unmute, please.
Thanks, Nishant, and thanks to all the attendees as well for making time this afternoon. I would say the last 3 months have been quite interesting for us as an organization, and I would say also us looking at other organizations. Our core business is actually diagnostic testing to help people get blood tests, scans, whatever they need, right? And though we're lucky to be in the healthcare segment, in terms of business impact, there was a drop, but healthcare is recovering at a faster rate than other segments that you can see. Though we see that our core business starting to recover, one of the challenges that we started to see was even when we were thinking about restarting our own operations, right? There was so much fear across both our on-ground healthcare workers. So we have teams of phlebotomists who come home to collect your samples, the amount of fear for them to just go back to work. And then you have simple people, like people who work in a call center. They want to come and do calls. And typical setup of a call center, you have a lot of people share the same space, right? So people are sitting close to each other. And generally there was a lot of fear. And this fear was not just like driven by individuals. It was largely driven by individuals and families, right? So even if a person wanted to work, the amount of pressure internally in the family where someone or the other is scared. And that kept happening often and often again. So for about 10 days, we turned off all our home services because it was just fear. Everyone panicked. On top of this, early COVID days, like Anjali mentioned, a lot of operational challenges with curfew being put in place. We had a few healthcare workers get beat up by the cops because they didn't know what was essential versus non-essential. And so there were layers and layers of fear. One was, A, will I get COVID? B is, if I go out and travel, will I be allowed or will I get beaten up? Because this is the kind of thing where like it just takes one healthcare worker to get beaten up to scare like 100, right? Because no one will be out to go do that. And all these guys have been working with us for years. They talk to each other. They have WhatsApp groups and they're connected as well. So the kind of fear we started to see across the layers. It was more with frontline healthcare workers and then lesser with people working in an office, but not enough to encourage people to come back. The only reason people wanted to come back to work was if they lived with families and families where they didn't have too much private space and then they wanted somewhere to go. I think that was probably the only reason where I saw people wanting to come to an office space, because that was a break from home. And so as we started thinking about getting to work, there were three primary things we focused on. One is, how do you give employees confidence to come back to work? The second one is, okay, if I do start my work, am I compliant, right? There were so many, like the central government says certain bunch of rules, the state government says a set of rules, then the rules are different across each state. So there's a concern directly at even my level saying, hey, if someone is COVID positive in my office, how does it impact me? How does it only worsens the fear, right? More and more people will not want to come into work. So we started looking at very simple things, right? So where do people live? Are they living in a containment zone? Do we know that information? And turns out you know very little about your employees beyond like the basic details, right? You don't know about their health, whether they're comorbid or not, whether they have any families that are at high risk if they get infected. Do they live with older parents? Do they actually live in an area which is high risk? So these were questions that were coming back to us. And what was interesting was a period where we would only use the office to drop off and pick up equipment, right? Because we had people working from home and laptops and phones get broken and then you have to replenish that. And so I would go into office just to open it up so people would come and exchange equipment. And what we noticed was the dynamics across the city. There were areas where they're completely paranoid and there are areas where there's higher infection rate and people would show up to office without a mask. And I'm like, I don't want to be near you, right? I don't want to subject any other employee to be near you. So these kind of incidents kept happening over and over again. And at that point, we decided that there needs to be a better way for us to do this. Coming from a healthcare angle, we wanted to make sure what are the medically right things to do. And then obviously coming from like running your own organization, how do you run an organization in an environment like this? So we came up with a concept called Safe Workplace of the Future. And the idea is to help organizations get back to work. Largely what I've also noticed in talking with organizations is there are two kinds of organizations. Organizations that have seen a decrease in productivity and organizations that have seen an increase in productivity. Now, I'll focus on the organizations that's seen a decrease in productivity because these are the guys, they're thinking like, if we get people back to work, things will go back to normal. And they're the ones who are trying to move faster. But like the challenge over there is when people think about coming back to work themselves, a lot of people that I talk to, the leaders themselves need to come back to work if you want the employees to follow. Right? You can't be sitting at home saying, I'm going to work from home and then everyone else should be in office. So that's one of the challenges we see. So how do you actually make yourself feel safe, right? That's the first thing you need to answer. If you're going to go back to work, how do you feel safe and what kind of an environment can you function in? And I think for us to actually be able to do that, it requires multiple things. You need to make sure that you have enough information about your employees, you have enough information about what's going on at the state level, you have enough information about what's going on at the central level, and then you need some way to distill all that information to action. So that's what we did with Safe Workplace. What we've done is we put together, like we already have medical records and all that as part of our core product. So we put together that with making sure that we have safety related, I would say compliance related checklists for both central and state level. And then also making sure that that's easily accessible to whoever's running that organization, whether it's your HR or facilities management. You want to have an easy dashboard which aggregates all of this information so that you know what's happening in which, and if you have multiple locations, you know what's happening in each location. An example of that is if you have 400 employees, right? You want to make sure how many of them are actually showing symptoms, or how many of them have a history of some sort of medical condition. How many of them have traveled in the recent past? How many of them have come into contact with the COVID patient? Are any of them hospitalized so that you can provide better care? Right? These are things that we don't know. And these are things that change on a daily basis, right? So you need to make sure you're capturing this information for all your employees every day. Now, not all your employees will be literate, right? And this is across, if we look at factories, not all of them have a smartphone, right? So you need to support this in multiple languages through multiple technologies, whether it's app-based or IVR-based. You really need an infrastructure to be able to pull up this information so that you feel confident in order to get back to work. Now that's just the starting. Now, once you get back to work, you actually need the workspace to be redesigned for you to actually be safe. You guys have already talked about the social distancing and the SOPs that you need to be in place. But I think we need to go a step further. We need to have actual technology, like Anjali said, change the way we design our workspaces, whether it is simple things like, moving from a biometric attendance system to a facial recognition one, right? So you want to make sure people are showing up to work, but you don't want them to touch a sensor. You want to make sure that when people are coming into work, and if you have a cafeteria area, people are still wearing masks and social distancing. And like Anjali said, you could have a CCTV camera, which is actually monitoring not just for our people social distancing. You can monitor for whether they're wearing masks. You can monitor for what their body temperature is. So there's enough technology that's already available today that is essential, I would say, to actually making your safe place work for you to go back. I think one of the big questions that I've seen a lot of people ask me is, hey, what do I do if someone is COVID positive in my office? Or what do I do if someone sneezes or someone coughs? Now that's a dangerous question, because all of us catch the flu from time to time. We don't know what it is. And an organization that has, like, let's say 100 employees working in office, you're not going to monitor every person and see if someone sneezes, coughs. You can't be scared of that, right? So you really have to enable yourself. And so we're looking at technologies that can actually detect someone coughing on a campus. Like you can say, hey, this person coughed, and you can actually do something about it, make it actionable. And even within the organization, you need to have an SOP from, hey, I suspect if someone is showing symptoms or someone has some sort of suspicion of COVID, that you actually have isolation spaces. You are set up to be able to connect to a doctor remotely. And that's where most organizations don't have access to remote doctors. They might want that today. And for your employees to feel safe, I definitely hope that you need to have that. Second, even when the doctor is remote, there's enough technology today that you can actually transmit breathing rate, heart rate, vitals to the doctor remotely while the doctor is interacting with the patient. COVID being a respiratory disease, your breathing rate plays a big role in that. And as much breathing rate data as you can give to your doctor, as much temperature data as you can give to your doctor, the better the doctor is in a position to make a judgment call on whether you need to actually go isolate yourself, go get a COVID test. How do you actually react? And all of this needs to be traceable. So you need to log this every day. All this information needs to be like every employee per day, you need to have all this information. And so that's a big challenge here. So when I think about going back to work, it scared me, honestly. And so a lot of it came back from our inner need to kind of just feel safe for ourselves. So today, I would say we're at a point where we're offering the entire ecosystem, starting from, hey, how do you actually track your employees, their health, their COVID safety status, their family, to how do you automate your workplace? How do you redesign that? If you are suspicious, how do you set up remote consultations and then get tested? And then what do you do from there? Do you need to get quarantined? So we've made it so that there's a centralized dashboard for each HR, and there's an app for each employee, which tells them what to do, right? So you got to take out the fear and you got it action-based. You got to give people a checklist. Hey, here are 3 things you need to do based on your current scenario. And that's where I think technology plays a large role. Software plus hardware solutions today will be involved in redesigning the workspace. Right. So I think
what you're offering.
Yeah.
Sorry.
So what we're offering is both hardware and software solutions to automate the monitoring of your workplace, so all your employees feel safe.
Yeah, this is great. I'm sure there's a lot of offices out there, lots of heads of organizations who are extremely worried about this issue, and they want to create a safer workspace going forward. And the suite of products that you have, I'm sure will be extremely helpful for many organizations. So thanks. I think again what you're doing is absolutely brilliant. Devang, let me come to you. I think we've got some limited time before we open it up for questions. Devang, you've probably got a far wider outreach just in terms of the sorts of businesses you may have invested in or maybe looking at in these circumstances. You're getting to analyze a lot of these business models. What is interesting out there? How are you, one, dealing with your existing set of portfolio companies, perhaps helping them change and become more relevant in these times? And the other interesting bit we would like to hear from you is what lies in future and what are the sorts of businesses that would be interesting to you?
Right, thank you. Thanks for the question. So until invest in scales early stage companies at pre-series A and series A, I happen to be in the sweet spot because I handle the healthcare vertical. So it's happens to be probably the most exciting area for investment in scaling activities. So to quickly, broadly the portfolio is into 2 parts: healthcare or not into healthcare. I think, like I said before, just I think as we were chatting before the call, companies predicated on, congregation of people may it be like, helping plan a wedding or a vacation or things like that. Those are clearly struggling today. So those startups are, we're not looking from a funding standpoint, and if they happen to be in the portfolio, we're helping them navigate through this difficult time by stretching the runway. And, I think, renting an office space is a natural area of concern and of business model refinement. So, I think a lot of them have cut their leases or looking at flexible leases. A good percent of the workforce has moved from home and most likely will continue to work from home because I think people have just now been evangelized to the fact that you can work from home and be more productive by saving travel costs, especially in a place like Mumbai. So travel cost and time, productivity gains and all that. And on that note, I think the good thing is that, a lot of the startups, by definition are younger people in India, right? So they are much more comfortable with collaboration software of all kinds, be it the whole Google suite, Google Docs, Google Meet, offline collaboration, online collaboration, Slack, LinkedIn, WhatsApp, Twitter. I think these startups traditionally have been much more comfortable with working through productivity tools that are online. And as a result, they haven't seen such a significant decrease in productivity as compared to maybe other traditional businesses, which are more, shall we say, handshake driven, where you just have to go and meet clients, go and keep making sales calls and things like that. So in that sense, they managed to navigate these scenarios pretty well. Now, healthcare, which is a lot of what we spoke about already, is where we and especially I am focusing on. Our startups have made pivots aligned with COVID pretty well. So Nihar has strung together an offering with 2 of our startups, which he spoke about, which, it combines logistics of IT testing and results. It combines breath analysis, which has been proven to be the only differentiator between flu and COVID. And really powerful temperature screening built on top of thermal scanners and overlaid with AI and ML tools to give a really holistic and powerful offering. So as Nihar mentioned, to give any HR person, literally a dashboard. You can log into a dashboard every morning. First thing, all the employees self-attest to their, their health conditions and their environment. HR person can make immediate decisions on work from home or come into the office. When they come into the office, right at the doorstep, you can screen for temperature, breath. You can make immediate decisions like a triage on whether you come in or you should work from home. If you come in, you should be quarantined, or you're safe to mingle in a limited way. You need to be tested. Are you okay to work the whole day with your colleagues? Can you go into the cafeteria? Do you have to stay at your desk? All these critical questions, which I think the workforce will face on a regular basis, on a daily basis in the short and midterm, can be answered by the safe workplace offering. So I think as an investor in these startups, we are helping them create these offerings and position them within enterprises, especially those that will see a pretty pressing needs to bring at least a portion of their workforce, I should say, back to the workplace in the near future.
Thanks, Devang. I have a question from one of the attendees here. How can we safeguard the healthcare, housekeeping, and other staff who are into floor management services because they are the feet on the floor and do not have work from home options? I guess even the statistics kind of bear out that, unfortunately, a lot of the healthcare providers are the ones who've unfortunately been hit by these infections. Anjali, I think that question squarely falls in your domain. Would you like to answer that?
Sure. I mean, I think, the safeguarding trick that we're learning now is repetition. And as Nihar also mentioned, learning about their family, learning about the interactions and the people they're meeting. So that's one aspect. And the second aspect is just training every day, because, you see people that will be wearing a mask and then to converse, they take the mask down, which is the point where you should not be taking the mask down. And we see that especially with some of our, ground staff. And it's it's like almost like you have to be a PT teacher or a school headmaster. You have to have your whistle and you have to say, no, you can't do that. And repetition of training, I think, is the model that we're finding out the most. But also we've had cases, we have our hospital in Gujarat is a multi-specialty, and we have treated about 400 COVID cases there so far. So unfortunately in that, I think we had one nurse that got it, but the whole time the nurse had it, we treated her at the hospital, got her better. And, we have we're calling them COVID warriors, where our nurses and frontline staff, all the work that they're doing, but we also have made sure that anybody that gets it or gets exposed, we are doing all that we can to help them, from taking them to the best hospitals or treating them ourselves, to monitoring them, making sure their family, everybody is safe. And that was our very first priority, to make sure. So while we've had, one case, it's very fortunate that we haven't had more, because we've been very, very vigilant. And even with housekeeping staff and, F&B staff, everyone, we've been extraordinarily done extra vaccinations, extra training for them. As an organization, I think we have taken that as the first important thing that we do, is safeguard everybody. What are all the things we can do, and make sure we're providing them the right equipment and the right knowledge on how to use it. And as I said, it's repetition, because for some reason, after 2 days, if you train someone, 2 days later, they forget about it and they think it's not that important. So again and again, I think that's the biggest challenge that we faced.
Yeah, thank you. There are no further questions from attendees. I can see one right now. Let me take a look at it. So one of the attendees is looking for ideas to manage a manufacturing unit with 15,000 employees and how to keep the unit safe. I'll open it up for anyone who can, who feels they have an answer.
I think Nihar is well positioned to take this one.
Yeah.
I was recently talking to a company which runs a solar power plant, and they're building one, and they have about, I think 7 or 8,000 employees working there. And the single biggest thing I had to tell them is you have to think of this as an investment in your future. Because when cost becomes a factor, you're going to cut how safe things are going to be. And when you're thinking about things at 15,000 scale, you have to think of this first and foremost as something that you're investing in, your employee safety, right? It starts from that mindset, but after that, the next thing that you do is just look at a technology solution. You can't do this manually. At that scale, you need systems in place telling you what to do. You don't want to be alerted when something goes wrong. You want to know if something is going to wrong before it goes wrong. You want a system to tell you so that you can minimize what's going to happen. If you have 15,000 people working in a space, the amount of monitoring you'll need, especially if you're going to, again, like in Anjali's words, be PT teacher is crazy. Like you got to have so many PT teachers there in order to manage those people. So I would say the biggest solution you can invest in is have hardware that's monitoring your people. This is as simple as cameras that tell you what behaviors are happening. So monitor behavior, and then like Anjali said, have SOPs and repeat, right? You have to do both of these things. There is no easy way out. I'm sorry. This is what it takes.
Yeah, look, I think we've heard of a few cases, right, where you've got a manufacturing unit or you've got an office that's opened up and you suddenly hear of a few positive cases. The first thing you're required to do is just shut down and deep sanitize. But ultimately, I guess it boils down to the practices that you adopt, right? Hygiene has never been the strong point for Indians, but I guess people will have to change, and habits and just the way we approach things has to change fundamentally. I've got another question. That's for Amit. Amit, someone's requested if you could summarize strategies on managing a co-working space, especially a co-working space that has so many common areas, right? And how will things change in the next 3 to 5 years?
So I'll take the first part. I think clearly, with having a large network of these spaces, I think the biggest challenge that we were facing was, how do we ensure that when people do decide to come back, obviously it was government regulated, but when they do decide to come back, how do you keep them safe, right? Both the co-workers as well as, the employees and the extended employees, the feet on street. And, clearly, I think it was a mix of various things which both Anjali and Nihar kind of put out there. First and foremost, I think it was important to get our people trained who were going to ensure the SOPs that we put in place. I think that was clearly something that we, did early on. We understood that, we had to put out to our members who were coming back that this space is going to be safe. And clearly for that, we put out all the different SOPs that we formulated. It was a 50-page booklet that we extensively trained our teams and the extended teams in that network. So from things like how do you maintain hygiene, what's the frequency, how do you follow certain protocols, et cetera, et cetera. Second was physical interventions, right? I mean, clearly we had to intervene with providing either PPE suits or, a door opener that had a leg opening mechanism, to automated openings for our main doors, to how do you kind of behave in the space with protocols, with social distancing or marking furniture that could be used for sitting or not used for sitting, going back and configuring the space so that the 6 feet distance was being maintained, putting in interventions that ensured that people had proper gaps between the spaces, etc. And then the final part of it is technology, right? I mean, we had luckily launched our app which allowed basically people to use a QR code from your phone to scan. So there was touchless. They could order food at their desk so that they don't even have to come into our pantry space, because honestly, the pantry spaces, whatever we try, have the biggest challenge, right? Because people will take off their mask to eat food and so on. So, we ensured that as little of those common areas were being used, and, as people came back. And to be very honest, Nishant, it's not been a problem, right? We, Touchwood, have not had a single case. Our centers have been open for over 2 months, either with our members or with our extended teams, right? But I think, as we say to all of our members as well, meet us halfway there. You're only in the workspace for 8 to 10 hours. What you do at home, where you go post that, what your behaviors are, when you go to a grocery store, we don't control that. And it is your responsibility to meet us halfway there, because you are also as much responsible of your safety and other people's safety. And I think that campaign really, really helped. And I think that's the reason that we've been, God is kind, I mean, as all I can say, because we don't control a lot of things when it comes to, what people do outside. Coming to the 3 to 5 year window, to be very honest, Nishant, I think it's a bit of a wait and watch, because the reality is, if you are going to feel that we will de-densify and redesign the spaces, and people can be in these spaces at 30, 40, 50% higher, lower densities and so on. The India was built on $1 per square foot market, right? I mean, if you double that amount, a lot of the feasibility of businesses that was IT, ITS, back office, etc., I think will become unfeasible. So I think there's going to be a lot of technology intervention, and I'm sure companies such as Nihar's company are going to play a role in that. But clearly, technology will play a role. But just to say that I'll physically distance people and redesign my spaces in the long run is not the solution. Plus, I think humankind is very resilient. I think we all understand that, just as people are coming back, just the mask is making a big difference. The social distancing, people following protocol. So I think, and if there is a vaccine, then it's no different than a flu. So I think many people's behavior, and we as a company will also evolve as the environment around us is evolving. I'm fairly confident that maybe the de-densification will be about 10 to 20% of the solution, but technology will play a huge role as people come back and they start coming back to normalcy.
Amit, that's very well put. I think you managed to answer the last question that I had from one of the attendees who was asking about whether offices will get redesigned. And I think, that's just perhaps not the practical thing to do.
Partly yes. Partly yes. So don't get me wrong. I'm saying partly yes, but to say, I'm going from 60, 70 square foot density, now I'll work at, 130 square foot. It's just not going to work business wise. So.
Yeah, absolutely. Well, I think that brings us to the end of our discussion as well. Thank you so much. I think personally, I've benefited a lot from this discussion, and hearing so many different perspectives from from all of you. And I think what really helped was the diversity in your businesses, and it's all come together for a very, very interesting discussion. Thank you, everyone. Thank you to everyone who's attended this, and hope everyone stays safe and take care.
Bye. Thank you.
Thank you. Thank you.
Yeah. Thank you, everyone. Take care.
Thank you.
Thank you, everyone. Take care.